Latin America and throughout the world, chronic diseases such as heart disease, cancer, diabetes, strokes, and arthritis are the leading causes of disability and death. Approximately 1 in 3 adults suffer from 1 or more chronic conditions, and chronic diseases are related to 2 out of 3 deaths. They also represent a huge burden on our healthcare systems. Most of our total health expenditure, almost $500 billion a year in the case of Latin America, can be directly attributed to chronic disease. Although common and costly, up to 80% of chronic diseases' effects are preventable. Sticking to a well-designed clinical program, maintaining a consistent medication regime, eating healthy, and getting more exercise can help people better manage their illness, avoid complications, and prolong their lives. If we can do so much to prevent major health problems, why are we still suffering from them? The answer is simple. Our health system is not well equipped to deal with chronic disease. Chronic conditions require daily decisions: what to eat, how to behave, what and when to measure, when and how to take medication, how much to exercise, and so on. Each decision may require collecting clinical data such as blood pressure, glucose or oxygen levels, understanding how to integrate and interpret the data, and, above all, maintaining the right psychological mindset. If any of these 3 components fail, the decision may be flawed. Just a few faulty decisions are sufficient to take a patient off course. In the traditional healthcare system, doctors only see patients for a brief time every so often. Patients make 99.9% of their decisions alone, with limited knowledge, no data, and no support. No wonder patients feel lonely and scared, and more often than not, fall into the wrong decision patterns that fuel chronic disease. At AXENYA, we aim to extend the doctor-patient relationship outside of the consulting room and into patients' everyday life. Through a state-of-the-art remote monitoring and telemedicine platform, AXENYA's doctors and patients are connected at all times, 24 hours a day, 7 days a week, 365 days a year. AXENYA provides patients with their own health coach, always vigilant and available to help them follow their doctor's guidelines. By leveraging the latest technology, AXENYA connects with over 300 smart biosensors and applications. Through these connections, AXENYA can measure appropriate data over long periods of time in real-life conditions and make it instantly available to patients and their care providers in a coherent, easy-to-understand picture. AXENYA's latest generation artificial intelligence provides personalized digital guidance that motivates action. AXENYA's AI engine gives step-by-step directions in context and when and where needed. It also reduces scares by identifying problems early and sounding alarms or indicating actions before they become an issue. We are fundamentally changing the way it feels to have a chronic condition. With AXENYA, patients never need feel frightened, alone, or lost. AXENYA gives them event-driven, personalized indications of where to go next, based on their individual data and their unique context. And there is no need to guess clinical values. With AXENYA, data flows automatically into one trusted location, where it is always organized and ready for action. As a result, AXENYA patients feel better, have lower stress, and achieve clinical improvements that last. 88% of our patients feel the improved control, and their clinical metrics confirm that. These improved results imply not only a lower risk of suffering a heart attack, stroke, and death, but also significant reductions in total healthcare costs. We are starting to put a dent in those 500 billion. At AXENYA, our passion is to enable better care, drive measurable outcomes, and enrich the doctor-patient relationship in innovative, profound, and meaningful ways. Through technology, we are changing the way we handle the most critical healthcare problems. We are making medicine more personalized and precise, and we are, above all, empowering people to live long, happy, and fulfilled lives.